older adults. To protect yourself from the virus, try to avoid contact with people who display symptoms similar to those of pneumonia or the common cold, like coughing or a runny nose. Don't touch your eyes, nose, or mouth with unwashed hands. Wash your hands frequently with soap and water and scrub for at least 20 seconds. Use alcohol-based hand sanitizer when possible. Be careful when handling pets. The only current treatment for coronavirus being offered is supportive in nature. If you notice any of these symptoms and conditions, please contact your nearest professional healthcare setup. Help spread this information to everyone.
If you're HIV positive or have an STI, having unprotected sex with multiple partners puts them in grave danger. You'll expose every partner and their present and future partners to HIV or another STI. Use a condom every time you have sex. You can live a productive life even if diagnosed with HIV. Remember, early detection is key to your survival. Be responsible, protect yourself and others. Help stop the spread of HIV and other STIs.
Is on.
Good afternoon and welcome to another National Emergency Operations Center COVID-19 weekly briefing for the 9th of December 2020. Thank you very much for joining us and for your continuation in partnering with us in the management of the COVID-19 pandemic here in the Federation of St. Kitts and Nevis. Of course, over the past few days, we've had good news that there has been a vaccine and which has been approved, Pfizer vaccine, the COVID-19 vaccine, which has been rolled out in the United Kingdom. That's the good news. However, the bad news is that the BBC has an article that states that rich countries are hoarding the COVID-19 vaccines, and that even though we have a vaccine commitment which has been preached from this pulpit about COVAX and COVAX managing to secure 700 million doses of the vaccine or paying for them to be distributed between the 92 lower income countries that have signed up, we are getting this news that the rich countries are hoarding the COVID-19 vaccine. That's not good news. I would invite firstly Dr. Cameron Wilkinson, our medical chief of staff at the Joseph N. France Hospital, to give us a presentation on guidelines for mass gatherings. Dr. Wilkinson.
Thank you very much, Leslie. Can we start with the presentation? Now, when our borders opened on the 31st of October this year, we knew that there was going to be a great risk of reintroduction of the SARS-CoV-2 virus that caused COVID-19. And while we have very stringent protocols and procedures in place at our ports of entry, we know that there was still a significant risk of the virus entering the Federation undetected. And one of the things we have is this false sense of security, where if we hear that we have 25 cases, we assume that those are the only 25 cases. But it could be that 1 or 2 cases might have slipped in and we did not know. And that is why, despite the fact that we have no evidence as yet of community spread, we still need to continue with the non-pharmaceutical measures that we know are effective in controlling the spread of the virus. The World Health Organization has advised that avoiding the 3 C's, crowds, close spaces, and close contact settings, can significantly reduce the risk of community spread. And this is why we are taking proactive steps to control this. Right now, we know that we have 25 confirmed cases. I would not be surprised within a very short period of time, next week, next month, we hear that we have these numbers increasing, and so we need to remain ever vigilant in controlling these. Now, the persons who organize mass events, they have been asking for some strict guidelines so that they can understand what are the protocols in place so that they can know whether or not they would get permission for their events. And we put together some protocols, and these were sanctioned by Cabinet this week. And I'm sure that you will be hearing from the law officers also as to when we would start the introduction of this, which is almost immediately. Now, some persons ask, what is a mass gathering? An event counts as a mass event or mass gathering if the number of people it brings together is so large that it has the potential to strain the planning and response resources of the health system in the community where it takes place. And this is in the context of COVID-19, because prior to COVID-19, we'll be thinking about a mass gathering as a stadium that is packed with thousands of persons. But we now have to take into consideration the health system and whether or not we can deal with the outcome that would occur if we have significant spread following these mass events. One of the things we said about your actions as it relates to COVID-19, whereas, for example, if somebody knocks someone down, the person falls on the ground, and you see the immediate effect, you can go out unknowingly spread the virus, and your actions would not come into play until 2 weeks later when persons start getting sick. And we need to put into place things now to mitigate against this so that we don't have community spread. Now, in addition to the number of persons, we also take into consideration the location and the duration of the event. And we have a number of guidelines that we've put forward so that persons can follow. First, permission must be obtained from the Commissioner of Police, and this will be done in collaboration with the Chief Medical Officer for hosting these events. And we are asking organizers not to advertise these events until permission is obtained. We've seen situations where persons have been advertising events, people end up buying tickets, and then if they're not given permission, we have problems. Now, a gathering refers to a planned or spontaneous event, whether it is indoor or outdoor, with a small number of people participating or a large number of persons in attendance, such as community events, concerts, festivals, conference, parades, wedding, and sporting events. So we should be quite clear now what we are speaking about as it relates to these gatherings. Now, the number of persons present would significantly affect the risk as it pertains to the spread of COVID-19. The lowest risk, obviously, is associated with virtual events. And we recently saw the completion of the Calypso tents, where we had a number of persons looking at these events virtually at home, in the safety of your bedroom or in your living room. And this is what carries the least amount of risk. Once we start bringing more and more persons together from different households, from different communities, together in one space, then the risk of COVID-19 spreading significantly increase. And so the highest risk is associated with a large in-person gathering, where it is difficult for individuals to remain spaced at least 6 feet apart and attendees travel from outside the local area. And this is the scenario with the major mass events that we normally have round about Christmas and Carnival time. And so we're asking persons to take these things into consideration when they are planning their events. Because of this, we have decided to place a cap on the number of persons who can attend these events. And so going forward from now, there will be a cap on the number of persons who can attend these mass gatherings or social events, and this figure was factored into when we thought about the capacity of our healthcare system. In addition to the number of persons scheduled to attend, factored in when the decision is made is whether or not there will be music, dancing, alcohol, and the duration of the event. Because, as I said before, one can have 70 people sitting, probably social distance, at a funeral service, and they can cause much less risk as it relates to spreading the COVID-19 virus, as opposed to if you have 30 persons jumping and dancing, drinking alcohol and marrying within a closed space. And so it's not just the absolute number that we'll be looking at, but what happens at the events. Now, going forward, the event sizes would be in three main categories: small, medium, and large. Small is an event with persons number between 25 and 50, medium between 51 and 100, and large between 101 and 150. And consideration will also be given to whether or not the event is being kept indoors or outdoors. We know that the risk of the virus spreading is much greater if it's an indoor event as compared to an outdoor event. So a more favorable outlook will be considered if you are having the event outdoors. Now, the maximum cap, therefore, please go back to the slide. The maximum cap, therefore, until further notice is 150. For small family gatherings and where you have a few friends gathering, if the number is below 25, you would not require any permission from the Commissioner of Police. So permission will only be required if you're having an event with more than 25 persons. Next. Permission will also not be given for any indoor event that is over 100 persons, because I said before, the risk of the virus spreading in an indoor event is much greater as compared to an outdoor event. And the minimum square footage is 30 square feet per person for indoor events, so that you can have proper social distancing. As it relates to site visit, a visit will be made to the site to confirm the square footage submitted on the request, because sometimes persons submit applications and they give the incorrect square footage, whether knowingly or unknowingly. And an outdoor event location will also be visited to determine whether or not proper social distancing can be done when the event is being hosted. Sometimes persons ask, what is our break point where we would determine to put a stop to these events? If there is evidence of local COVID outbreak where we have isolated clusters of cases or evidence of community spread, then all social gathering and events will be stopped until the COVID-19 outbreak is contained. And what I mean by this, so far, all of the cases we've had have been imported. But if tomorrow we hear that there is a person who shows up, in the village or in Bastille with a call for a cold, with no history of travel, no history of contact with somebody who traveled, and they're tested and they're found to be positive for COVID-19, that would be indicative of community spread. And in that scenario, we'll have to put a stop on these multiplier events that lead to an increased spread of COVID-19. Now, there are certain things that the event promoters, entertainers, and organizers must know as it relates to the requirements. They have to submit their tax clearance and a valid business license from the Inland Revenue Department. A written outline of their protocols for hosting the event must be submitted with the layout of the venue and the security plan, and this will be vetted by the Commissioner of Police. They must submit the application on an online website, which will be provided to you just now, at least 15 days prior to the event. And we have committed to giving you a response within 3 to 4 days of your application, so that persons can't say they sent an application and had to wait several weeks before. And so this will make sure that you don't have to advertise before you get permission, because once you send your application in, you should get a response within 3 to 4 days of sending in the application. Now, the Protocols and Procedures is a very detailed document, but what I tried to do was to highlight the salient points and the most important guiding principles. But this would be circulated to all persons who are involved in mass events, entertainers, etc. And other matters that are addressed in the document is how you can promote healthy behavior while you're at the event, letting persons know, for example, if they're ill, they should stay home, because you could be advertised an event, you could have persons who are showing up with flu-like illnesses, and it's important for us to make sure persons understand this. We address hand hygiene and respiratory etiquette, because in these, at these events, people are shouting, screaming, sometimes they're shaking hand, fist bumping, etc. We address adequate supplies, because it's okay for us to say you must hand sanitize, but sometimes persons can have an event and they may not have enough hand sanitizers, etc. We address physical barriers and guides, how you address food services at the event, the fact that you should not have any buffet service, and that most likely the food, if you're going to serve it, should be pre-packaged. So there are a number of issues that are dealt with in this document, and hopefully this document would be circulated widely so that all the event organizers, they should be quite clear as to the way forward, so that we can have a safe Christmas season, and we all can look forward to a new year with the vaccine around the corner, and hopefully within a few months we could be out of this crisis and be back to a near normal. Thank you.
Thank you very much, Dr. Wilkinson. If it's one word that we have learned in the past months, weeks, we now hear super spreader events. New terminology, super spreader events. I now invite Superintendent Cromwell Henry, Divisional Commander for District A and a member of the COVID-19 National Task Force, so is Dr. Wilkinson, Superintendent, to give us his presentation.
Good afternoon all, and thank you, Mr. Williams. Just before I go into my presentation this afternoon will be based on the launching or the introduction of the website that Dr. Wilkinson made reference to, where persons will be able to apply for permission for their events and make the process more efficient and timely. I just want to touch on an incident that occurred recently, and again, this follow on from what Dr. Wilkinson would have mentioned, that despite our tight entry protocols at the borders, something or someone may slip through unnoticed and cause havoc in the community in terms of COVID-19 spread. I just want to bring an incident that occurred to your attention to give an example of what Dr. Wilkinson was referring to. One second. On Monday, the 7th of December, a cargo vessel was docked at the Deepwater Port. And as a public health measure, these vessels have been operating under condition that the crew remains on board and have no physical contact with persons on the dock. Just after 7 p.m. that evening, 2 of the ship's crew members were intercepted returning to the port in a vehicle being driven by a staff of the ship's local agent. The relevant authorities were informed and an investigation commenced. It was revealed that the men went shopping in a nearby supermarket before returning to the port. Well, the driver is presently in quarantine for 14 days, and the 2 crew members were detained and taken to the JNF hospital for testing. This incident is currently still under investigation, but I bring it so that you will see these are the kind of incidents that could occur, that could possibly put our people at risk. And that is why we continuously ask persons to adhere to all the COVID-19 protocols, despite the fact that people resist and ask, why do we have to follow them when you have such tight controls at the airport? Well, this is a reason why you have to follow the protocols. So we continue to admonish persons to avoid crowds or crowded areas, crowded places. Maintain your physical distance of 6 feet, wear face masks when in public, and practice good hand hygiene and sanitization habits. These are the things that would keep you safe should you come into contact with someone who may be positive. Once you are observing these protocols, then more than likely you would be safe. Now I'll go now into what I really want to speak to with respect to the website. It has been a long-awaiting project. Before the slide roll along, I will just speak. So the slide could remain up. That page could remain up while I give some background to the website. Now this website is part of the police force's COVID-19 response using technology. It provides for a total contactless means for event organizations and other members of the public to apply for permission to host events of all types, pay the necessary processing fee, and receive your approvals or otherwise without coming to the police station. It also allows for police officers in the field using a custom-built scanning app on their smartphones to scan the QR code that will be sent to event organizers and retrieve all the details and conditions for approval for that particular event. Again, this eliminates the need for the police officers to have to ask persons to present their written paper permissions, and police could have a digital version of their permission through their mobile phones. The project was made possible through a partnership between the UNDP, through its Carib Secure project in St. Kitts, the UK government, and the Ministry of National Security. All 3 entities shared the development costs of this application. Well, on behalf of the Commissioner of Police, we want to express our sincere gratitude to these agencies. I must also express a special thank you to 2 of our local service providers, Flow and Digicel, who both have graciously agreed to zero-rate the website and the mobile app. This means that customers of these companies can access the website on their mobile devices without affecting your data allotment. In other words, access to the website will be free. This is especially significant to our police officers in the field who will be able to scan the QR codes or otherwise access the database to see what events have permission and the condition of these permissions at no cost to them. The online application also makes provision for members of the public to apply for and receive curfew exemptions should that ever becomes necessary again. We hope not. This new online event permission system will significantly improve the efficiency of the Office of Commissioner of Police in processing and responding to applications to host events. Events organizers are required to submit their applications at least 15 days prior to the event, and you should get a response one way or the other to your application within 3 to 4 working days. This will apply to applicants both on St. Kitts and on Nevis. You just need to select the appropriate island on the application form when submitting your application. Now, I will just do a brief run-through of how the website looks and feel. To access the website, you would go to www.police.kn, and this should work on any browser, whether Edge or Chrome, or if you have iOS, it should work on any browser. The homepage, on the homepage of the website, you would have several options. One option, the icon for curfew e-pass or events permission. We hope that we were just using the events permission icon. So you click on that particular icon, or you could select it from the menu bar. So you click on event permissions, and that will take you to the first part of the form. The form is divided into two parts. There is the general details section, and there is the event details section. The general details section has two subsections, and this section you would place your name, your email address, and your email address is important because this is how you would receive communication from us. You will get your whatever instructions you need to get, as well as your approval. You will get it via this email address that you provide. You would also provide some details about you, your date of birth, for example, your telephone number. You have to upload a copy, a photo of your government-issued ID, either driver's license, voter's ID card, social security card, or the biodata page of your passport, and a photo of yourself. Now you could take your photo with your cell phone and upload it, but we prefer that the background be a plain background. And we prefer also if you have someone take the photo for you rather than you taking it yourself as a selfie, and upload that photo to the website. You would save that portion of the application form. Go to the next slide. And then you would get the events details portion. So on this portion, you would enter details about the event. How many persons are you applying for? How many persons you expect at that gathering? And we have that broken down into male, females, and children. You could give approximations. You do not have to give exact numbers. You indicate whether or not you have VIPs at your event. If the answer is yes, you would get additional fields to place the name of the VIPs and their positions. If you're inviting foreigners, for example, you have a fete or an event where you have overseas guests, overseas artists, you would indicate who these overseas artists are. That would be important for us to know. The expected number of vehicles, you would also indicate those. There are some events that are based on vehicles. For example, tailgate event last week, that was an event where persons come in their vehicles. So we would need to know the number of vehicles that you expect at your event. You would also need to indicate the type of security that you would have, whether private security or you require police security. You would indicate whether you have food and beverage, and indicate some details about the venue. There's a drop-down list of venue types, whether it's a playfield, it's a stadium, it's an indoor function hall. Whatever the venue type is, you will select it from a drop-down list there. You indicate also the jurisdiction of the police station. Now, this is important for us because the website is divided into the policing district. So each police station would only see events within their area of responsibility. So, for example, the Bastille Police Station, officers in Bastille Police Station would only see events that are occurring in Bastille. So it makes it easy for them to know what is happening in their district. The Frigate Bay Police Station would only see events that are occurring in the Frigate Bay district. And right around the country, these police stations would only see events that are occurring in their district. So you would have to indicate which police station district your event would be held. And then you place the address, enter the address of the event. Now, this particular field, document upload, this is where you would upload your COVID-19 protocols compliance plan. Dr. Wilkerson would have made reference to it. How do you intend to comply with the COVID-19 protocols? your security plan, your whatever you need to do, whatever you intend to do to comply with the COVID-19 protocols, you would upload that document on this particular page. Depending on the type of event, it's not all events you would see the tax clearance certificate field, but if it is a FET, certain types of events, you are required to upload a copy of your tax clearance certificate from Inland Revenue, and depends on the type of event that you select, that particular field would become visible. All the fields are required. You'll be required to enter information in all the fields, otherwise you will not be allowed to move forward. Now, once you would have completed the form, you would get a preview of the page. So all the details that you would have entered would be packaged together and presented so that you could review it and see if you need to make any changes. It would give you an option to edit if you want to make any changes on the application form before you submit. Now, there is a small application processing fee that comes along with the website. Some events or some categories of applicants are exempted. So, for example, schools and churches and government departments, they are exempted from the processing fee. So if you are one of these particular categories, you would go straight to a submit button once your form is completed. But if you are other entity other than those that I've mentioned, school, government, or church, you would get a submit and pay. Next slide, please. You will get a submit and pay button. So if you are exempted, you will get a submit button where you submit your application. If you are not exempted, you will get a submit and pay button. So once you select that submit and pay button, it will take you to the payment screen where you would enter your credit card details and submit those details on from that page. Now, you may ask about security. We had to satisfy the bank that the website is secure. We had to meet certain stringent security measures on the website. And so we want to assure you that the website is secure and that your credit card information would be secure as well. You will get a series of emails once you would have submitted the application form. You will get an email indicating that you would have successfully submitted the application. It would give you a reference number, and it would give you a link where you could go to check on the progress of your application. So you would enter your reference number into the field when you follow that link, and you would get updates on the progress of your application, whether it's pending, whether it's approved, whether it's declined. Whatever the state is at, you would get updates once you enter your reference number in that field. It would also indicate to you whether or not you have the amount that you have to pay. If you did not pay at the time when you submit, you will get an email indicating that you need to pay, and you will get a link to take you to the payment page. This is a sample of the email that you would get. Okay. Now this is the payment page that you would be required to enter your credit card details, and the system would not allow an application to be approved if payment has not been made. So we would get the application, but the system would indicate to us that payment has not been made and it would not be possible to approve. It's just not possible to approve an application where payment has not been made and payment is required. Of course, it could be declined. So you most likely would get a decline response if the payment was not made. So it's important that at the time of application that you pay the necessary processing fee to avoid any delay in getting your application approved once you qualify. Next slide. At the end of the process, you would get a confirmation page indicating whether or not the payment was successful, and basically a receipt of your payment with all the details of the transaction. If there's any query, you could always use this information, have on the reference number, the transaction number, the authorization number, all the necessary information to track your payment if there is any dispute that may arise. This is the page I spoke about where you could track the progress of your application. You would enter your reference number into the event status field. You click submit, and it will give you the status of your application and some details of your application. You could even download your application form if you need to make reference to it for any other reason. You could download the application form from this page. All right, well, we want to thank you. That brings us to the end of the presentation. Again, the website is www.police.kn, and effective immediately, you will be required to go to this website to make application for your events. Dr. Wilkerson would have outlined the guidelines that we will be guided by in terms of the number of persons that will be permitted at the various type of events, the period within which you must submit your application, and the other guidelines that he would have highlighted. We will seek to put that information on the website so that you have it readily at your fingertips, and we hope that persons would comply, and we ask for your fullest cooperation. Thank you.
Thank you very much, Superintendent Henry. I would now invite our Medical Chief of Staff, sorry, not the Medical Chief of Staff. She usually comes before Dr. Wilkinson. Chief Medical Officer, Dr. Hazel Laws, and a member of the COVID-19 National Task Force, to give us the Health Emergency Operations Center situation report. Dr. Laws.
Thank you, Mr. Williams, and a pleasant good afternoon to everyone who is joining us this afternoon. As per usual, it's my task to share with you the Health Emergency Operating Center Situation Report for Wednesday, December 9th. Last weekend, more specifically last Saturday, December the 5th, the Ministry of Health would have issued a media release announcing 3 additional cases of coronavirus disease within the Federation. One of the individuals landed in St. Kitts on November 20 from India. The other individual would have landed on November 28 from the United States of America, and one individual landed in the Federation on November 29th from the United States of America. Ladies and gentlemen, this afternoon, Wednesday, December 9th, I want to use this platform to announce yet another case of coronavirus disease. And so, yes, we do have an additional case. This is hot off the press. We just received that call at 5:01 p.m. this afternoon. So we have a total of 26 confirmed cases of COVID-19 from or within the Federation of St. Kitts and Nevis. This individual, or this last case, landed in the Federation on November 25 from the United States of America. I want to assure the general public that these 4 additional imported cases have been in quarantine since they arrived on the Federation. And so, given our 26 cases, the rate of infection of COVID-19 in the Federation per 100,000 stands at 48.9. And so in terms of total number of confirmed cases of COVID-19, St. Kitts 18, Nevis 7 plus 1, or a total of 8, and the Federation has a total number of confirmed cases of 26. 26 confirmed cases of COVID-19. Globally, based on the World Health Organization's COVID-19 dashboard, the count in terms of the total confirmed cases internationally, it stands at 67.5 million. The total number of deaths stands at 1.54 million. In the United States of America, there are 15.1 million confirmed cases and 338 deaths in the United States of America. What's happening in the Caribbean region? Based on the Caribbean Public Health Agency's situation report, dated December 7th, there are 307,232 confirmed cases within the Caribbean region and a total of 5,306 deaths from COVID-19. In St. Kitts and Nevis, we continue testing all the returning nationals and incoming travelers. And to date, we would have tested 4,335 persons, and we have had 26 positive cases so far. And so in terms of numbers of persons in isolation, we now have 3 persons in isolation. Total number of persons recovered, 23. Total number of cases, 26. Pre-approved quarantine at home, we have 20 such individuals. Number of persons in other quarantine facilities, meaning government-assigned or designated sites and COVID-19 approved hotels, 313. And so by way of information, we have quite a bit to share this afternoon. Okay, so we continue to provide the website, www.knatravelform.kn. And so this is the website you log on to if you want to complete the entry form ahead of coming into St. Kitts and Nevis. Okay, so we want to just highlight the fact that the Ministry of Health accepts the gold standard, the reverse transcription polymerase chain reaction, which is the RT-PCR laboratory-based molecular test. And so we require a negative RT-PCR test result. We want you to do that test within 72 hours of traveling to the Federation. And so this is the reverse transcription polymerase chain reaction test, not the real time. It's the reverse transcription polymerase chain reaction laboratory-based molecular test. That's the gold standard, and that's the test we accept. We are not accepting the rapid antibody. We are not accepting the rapid antigen tests. We continue to get a lot of questions regarding children. And so, yes, parents who are coming back with children or international travelers coming with children, we do require them to also have a negative RT-PCR test done within 72 hours of travel. And we want children to be accompanied by at least one adult. Children are also, we want to assure you that it's safe and that children are tested here in the Federation upon completion of their quarantine period. Okay, we want to also highlight the fact that there are travelers who may have special needs. For example, persons with chronic medical conditions, individuals who have to travel via wheelchair, who may have challenges with activities of daily living. These individuals, we recommend that you provide us a medical report. This medical report can be sent to Office of the CMO at gov.kn, because in fact, Such individuals should be accompanied by an adult to ensure their safety and comfort during the 14 days quarantine period. Because as I said before, there are individuals who may have traveled in a wheelchair, who may have challenges with activities of daily living, and they may need assistance in terms of self-care during the 14-day quarantine period. And so they would benefit if an adult is in quarantine with them. Okay, so let's talk about the vaccine. So last week, Wednesday, the BBC announced that the Medicines and Healthcare Products Regulatory Agency in the United Kingdom granted approval to the Pfizer-BioNTech vaccine. And so the MHRA granted temporary authorization for emergency use of this vaccine in the United Kingdom. The rollout of this vaccine actually started yesterday. So those of us who would have watched BBC, we would have seen Martin Kenyon, I think his name was, and William Shakespeare, two of quite a bit of older adults who would have received this vaccine. So the first vaccine was administered yesterday, Tuesday, December 8th. So it was rolled out in a number of hospitals in the United Kingdom. We understand that the UK would have purchased over 800,000 doses to be administered in the first instance, and the UK has ordered over 40 million doses. So they intend to vaccinate about 20 million of their nationals and citizens. Fresh off the press, today, Canada announced that they are joining the United Kingdom. Canada's health regulator approved the Pfizer-BioNTech vaccine. Health Canada called the authorization a critical milestone in Canada's fight against the coronavirus. Canada is set to receive as many as 249,000 doses of this vaccine. And we note that the United States of America's Food and Drug Administration, the FDA, is set to meet tomorrow to make a critical landmark decision with respect to the authorization of this vaccine in the United States of America. Pfizer-BioNTech's vaccine requires ultra-cold storage at negative 70 degrees Celsius. However, once it reaches the center where the actual vaccine will be administered, it can be stored in a regular refrigerator and it must be utilized within a window of 5 days. The vaccine requires 2 doses to be taken 21 days apart. So the data from the trial tells us that immunity starts about day 12 after the individual would have received the first injection. And full immunity is achieved 28 days after the first injection. All right, so let me just explain. All right, so let's say yesterday, William Shakespeare received his vaccine, day 1. On day 12, his immunity against the virus will be mounted. In 20 days, he would receive his second dose. So that's 21 days after the first day. And then 28 days after yesterday, the first day, he would have mounted full immunity against the virus. Now, the vaccine uses COVID-19 virus genetic code or messenger RNA to prime immunity. In the United Kingdom, the vaccine is being offered to healthcare workers in the National Health Service, residents in long-term care facilities and their care providers, and older adults over age 80 with comorbidities and hospital appointments. Just today, the BBC announced an allergy warning over this new vaccine. So apparently yesterday, amongst the thousands of persons who would have received their first dose, 2 NHS workers experienced allergic reactions shortly after receiving the vaccine. The data or the information on BBC tells us that both NHS workers, they have had a history of serious allergies prior to this, to the point where they both carried an adrenaline auto-injector or adrenaline or EpiPen, as we would call it. And so this is a strong warning. So individuals who suffer food allergies, allergies to previous vaccines, or allergies to previously taken medication, you really should avoid taking this vaccine. The trial reports 1 possible allergic reaction per 1,000 people or person immunized. And this is from BBC Today. Some additional data regarding this vaccine. As I said before, protective immunity builds up within 28 days or 4 weeks following the first dose. And so there's a question that most persons are asking: how long does immunity last after receiving this vaccination? The answer, we are not sure. Second question, does this vaccine protect everyone? The answer, no. In the trial that was conducted prior to the authorization of this vaccine, the vaccine did not prevent everyone vaccinated from contracting the virus. Does the vaccine stop persons from catching the virus? Does the vaccine stop persons from transmitting the virus? The answer to those 2 questions, we still do not know. Question, has the full data from the trial been published? No, it hasn't. So ladies and gentlemen, there are still many unknowns regarding this vaccine. And scientists and health practitioners like ourselves, we are hopeful that this data gap will be filled within the next few months. So in other words, if, you can receive this vaccine, but we still do not know if receiving the vaccine will prevent you catching the virus. We do not know if when you receive the vaccine, it will prevent you transmitting the virus to someone else. So these are still unknowns. Pfizer-BioNTech vaccine, the trial participants were 85 years and under. So it's important to note that the trial that preceded the authorization of this vaccine only included participants who were 85 years and under. The vaccine was generally well tolerated by the participants in the trial, and we were told, or we are being told, that they only experienced mild effects. And some of these mild effects that I've seen in the literature include pain at the injection site, muscle pain, fatigue, headaches, and of course allergic reaction, because we've had 2 persons yesterday, 2 NHS workers who experienced significant allergic reaction post receiving the vaccine. And so, ladies and gentlemen, based on the information I just shared, and the data gap that still exists regarding this vaccine, we will continue utilizing our health and travel protocols, which requires you to provide us your pre-arrival RT-PCR test, negative of course, and when you come into St. Kitts and Nevis, we will maintain our quarantine period and our vacation in place period of 14 days. So the rollout of the vaccine at this time will not change our health and travel protocols. We are being told that the COVID-19 vaccines will be made available to Caribbean member states by as early as March, or let's say the second quarter of 2021. But please note, we are not sure if which of the vaccine candidates will be available to us. So I did mention that we will continue, we will maintain the 14 days quarantine or vacation in place that we have at present. Okay, so last week, Thursday, we received information, another news clip saying, and I quote, CDC will decrease coronavirus quarantine from 14 to 7 to 10 days in the United States of America. So basically, that article said that if you're in the US and you were exposed to an individual who was COVID-19 positive, you would quarantine for 7 days, test, and if you got a negative test, you can cease quarantine. And if you did not get a test, you can remain in quarantine for 10 days and then be released from quarantine. Now, there has been some misunderstanding regarding this CDC statement, because this really, this statement is providing guidance within the United States of America. Please note that in the United States of America, the COVID-19 disease is rampant. Contact tracing has virtually been abandoned, and there is a recommendation to reduce the quarantine period, especially in areas where the cases are rapidly rising and health authorities are inundated. So this is not the case in our Federation of St. Kitts and Nevis. So it's important to note that this statement or this recommendation is not made by the World Health Organization, it's not made by the Pan American Health Organization, but by the Centers for Disease Control for guidance in the United States of America. One of the directors of CDC provided the rationale. He said the goal for this new guidance is to increase compliance with quarantine protocols and potentially alleviate the economic burden on those in the United States of America who cannot meet the 14-day quarantine period. The Centers for Disease Control continues to endorse quarantine for 14 days and recognizes that any quarantine shorter than 14 days balances reduced burden against a small possibility of spreading the virus. Based on the foregoing, ladies and gentlemen, St. Kitts and Nevis continues to maintain the required gold standard 14 days quarantine period for all inbound travelers, along with the present health and travel protocols. Based on all that we would have shared and the data gap regarding the vaccine, it's important for us to continue to boost our own immune systems. So I want to recommend that we continue doing same through exercise, eating healthily, ensuring that we get adequate rest, ensuring that we are properly hydrated, and ensuring that we manage our stress levels and cope therewith. We must continue the COVID-19 prevention and control measures. These have proven to work. I don't think there's any data gap with respect to these prevention and control measures. Actually, we are receiving more and more scientific evidence to back these prevention and control measures. The need for us to continue wearing our face mask when in public places. The data is now showing the thousands and millions of cases of COVID-19 that has been prevented by just wearing the face mask. Maintaining appropriate and adequate hand hygiene, maintaining 6 feet distance away from others when in crowded spaces, and avoiding crowds and events with significant numbers of persons. Thank you.
Thank you, Dr. Laws, and certainly we must highlight again that even with the vaccine, that there is still a data gap, and that the Federation of St. Kitts and Nevis continues to keep all its protocols and measures, COVID-19 measures, in place even though there is the vaccine. That brings us to our question and answer segment. And the first question comes from WinFM. They have a slew of questions. The first question, how are there 5 active imported cases? But by the presentation, we saw that there are only 3 active cases at the moment. The others have recovered. Within the territory, let me start that. How are there 3, I put that from 5, how are there 3 active imported cases within the territory if they arrived with a negative RT-PCR test, the golden standard, and the Federation is free from community spread? Dr. Wilkinson.
That's a very good question. And we have said all along that a negative test is as good as the time when it was taken and when you receive that test. But you could have a negative test today and get infected tomorrow. And that's one of the reasons why we have serial testing. And despite the fact that you would have someone who would have submitted a negative test within 72 hours of traveling, if they were vacationing in place and they had a test done on day 7, or they were planning to come out of quarantine and they had a test done on day 14, they can still test positive. And we keep saying that we are not COVID-free. We speak about the number of positive tests that we have, but we keep emphasizing the fact that this is a tiny microscopic organism that one cannot see. And the same way at heavily guarded borders, people can smuggle in ammunition, trucks, etc. This virus can enter the Federation without us knowing. And that's one of the reasons why we keep preaching the non-pharmaceutical measures to contain the spread of the virus that might have inadvertently entered the Federation. And so when the CMO announced today that there was one more positive case, one has to assume that we could have others, but once we continue doing what needs to be done to prevent the spread, we would remain safe. CMO, I don't know if you have anything else to add.
Somebody asked a very basic question as well. When someone is diagnosed with the COVID-19 virus, what treatment are they given? Dr. Wilkinson.
Someone could be diagnosed having a positive test and they can be totally asymptomatic, and with serial testing they recover and have no symptoms at all. And so that person would not require any treatment. Some persons may have just mild flu-like illness and they're treated symptomatically. Paracetamol, if they have a fever, hydrating, making sure they take their vitamins and things like that. It's only persons who have significant illness where they have a drop in their oxygen saturation and they have to go to a hospital that they will require treatment. And we've spoken before about the treatments, for example, dexamethasone, if the person requires additional oxygen. There are antibody cocktails that are now being used, and so those are the treatments that are used for persons with advanced disease. But for the most part, most persons, the disease might be self-limiting and they may not require any treatment.
Next question is from WinFM. Again, how often are the certified taxi operators, tour operators, and other stakeholders who interact with incoming travelers tested? Dr. Laws.
Very, very good question, Mr. Williams. And so once we would have identified a case, we do contact tracing. So we evaluate all the individuals who would have come into contact with that individual along the corridor of containment. That is, from coming off the flight, walking through the health screening unit, immigration, customs, taxi, and the frontline workers at the hotel site. And so we evaluate these interactions, and we make sure that protocols were adhered to. So we even, at present, we are evaluating video footage of the individuals interacting with the front desk staff or the customs officer or the immigration officer, ensuring that protocols were followed. And if perchance we realize that there is a breach in the protocol, that frontline worker is tested and placed into quarantine. So not all the frontline workers who come into contact with a positive case is put into quarantine or tested. All right? So let me just back up. Some of them have been, and they've all tested negative. And so that provides us objective evidence that our protocols are robust and are working. And so the short answer is the frontline workers, they're only tested if indicated.
Thank you, Dr. Laws. The next question is also from WinFM. Do we have tracking bracelets or identifiers on those who are in quarantine in order for the public to be made aware that they are or should be in quarantine? I think the question that he's asking is, how do you know if someone who is in quarantine escapes from being in quarantine and puts the public at risk?
Okay, so another very good question. And at present, all inbound passengers are placed in quarantine either at a COVID-19 certified hotel or one of the government designated sites. And so if it's OTI, there is police and there are compliance officers providing security, watch over the individuals at that location. The same thing pertains at Potworks in Nevis. And in terms of the COVID-19 hotels, they all employ local security personnel to provide security for their properties. And so individuals at these hotels, they wear wristbands, and that highlights, the level of risk in terms of are they within 1 to 7 days of quarantine or 7 to 14 days of quarantine. And so far, between October 31st and present, the system has been working, and we have not had any instance whereby an individual, have escaped quarantine.
There's another question. Someone wants to know how the app use is actually going. The COVID-19 app, and if people are recording their symptoms via the app. Dr. Laws.
Mr. Williams, we have not launched the mobile app as yet. We are awaiting the legal framework. Once this becomes ready, the app will be launched, and then we'll be able to answer your question.
Okay, that eliminated one of WinFM's questions. The next question from WinFM. We are now safe harboring some 78 persons with another 87 coming into our waters. What are the procedures for testing if there is expected to be no in-person interactions between the people of the Federation and the ship's crew members? Dr. Laws.
Yes, the protocols for them to come into the Federation, they would have required a negative PCR test within 72 hours of arrival. And despite the fact that they have no plans to leave the ship, they will all be tested on day 14 to make sure that they are COVID-free after 14 days. So testing will continue whether or not they disembark the ship, because they will be within our waters.
This question, what lab services will be used to facilitate testing? And the second one, what is the turnaround time for the test results? Those two are from WinFM.
All right, so I'm assuming it's regarding the ship, the Rhapsody of the Seas. And so on December 14th, on the morning of December 14th, the public health team will be taking the samples from the 78 crew members on Rhapsody of the Seas, and the samples will be taken to the Next Generation lab. And within 24 hours, the results will be ready. Let me just, provide some backdrop to that answer. We would have processed over 150-something samples for the last batch of students that were repatriated for the Ross University School of Veterinary Medicine. And so we're going to use the same mechanism and methodology, and each batch of the Ross students, we were able to provide results within 24 hours. Thank you.
Thank you, Dr. Laws. And these are our last two questions for today. Is there any concern that people entering the Federation are providing fake negative certificates?
Very good question, Mr. Williams. I want to use this platform to publicly thank the 4 IT technicians who we recently employed to the Ministry of Health, who provides coverage of the entry form and the platform, the www.travelform.kn. They're the ones who scrutinize all the negative RT-PCR test results that we get from the inbound passengers. And to date, I am not sure. I don't think we've come across any fake results. What we've come across is the fact that there are a number of assays or tests that are available in the United States of America that have only gotten FDA emergency use authorization. They are not the gold standard RT-PCR tests. And so that's the challenge that we are having, trying to determine which one of these assays, should we really take a chance and accept. Thank you.
Someone just sent an additional question, but if someone coming from overseas and is mentally challenged, do they get special treatment in terms of quarantine?
All right, so Mr. Williams, that's a very good example of a patient who has special needs. And so if an individual is having a challenge in terms of mental health, probably the individual, is diagnosed with dementia or even Alzheimer's. Such an individual should really be traveling with an adult. And that's actually the next of kin of that individual should really submit a medical report to the office of the CMO.gov.kn so that special arrangements can be made upon arrival, throughout the check-in process, and even in terms of moving the individual on ground transportation from the airport to the quarantine site. And such an individual can really not go through that 14-day period without an adult being with them in quarantine. So let's say that individual comes into country alone. On the receiving end, a relative who is on the ground would be required to go into quarantine with such an individual.
And the last question for today, is there any consideration to be given to inbound travelers who, in compliance with requirements, took the test 72 hours prior to the travel date, but up to departure time 3 days later, still had not received the test results? Dr. Laws.
So, Mr. Williams, I'm not sure I understand the question. So, let's say I have applied to come to St. Kitts, and I'm in New York, and I went to a lab and did my RT-PCR test, and I am booked to travel on Saturday morning to St. Kitts from JFK. And at that point in time, I have not received the results as yet. Well, regrettably, we won't provide approval to come. That individual would, we would really await a result. Yeah? Well, let me just add, we've processed a number of flights so far, and majority of inbound travelers have been able to provide us the RT-PCR test within the 72 hours of travel.
Thank you very much to our Chief Medical Officer, Dr. Laws, our Medical Chief of Staff, Dr. Cameron Wilkinson, our Superintendent of Police, Mr. Cromwell Henry. Thanks very much to you. Thanks to Mrs. Christmas Jacobs. We welcome her back. We're happy that she's back with us. She was not here last week. Mrs. Christmas, thank you very much. We say thanks to ZIZ, as usual. We see Khalid Lake is here, and earlier on we had Mr. A.J. Evans, who was also here, to Vesta Southwell for her support. There she is waving. Mr. Abdia Samuel, the chair of the COVID-19 National Task Force, who did not make a presentation today. He took a break today. And to all of you who tune in to these NEOC COVID-19 weekly briefings, keeping up to date in terms of what is happening, that is quite important because you're called to play your part as well. We thank the media for its partnership with us in providing information and getting the news out with respect to what we are doing here in St. Kitts and Nevis. And as Dr. Laws mentioned in her report, we have had 26 confirmed cases of COVID-19, and there are only 3 active cases at present. We are doing much better than most, than hundreds and hundreds of countries. And so I think that the all-of-society approach is paying off. All of our frontline workers, we continue to thank them. Our data entry clerks who are working here at NEMA, looking at all the information coming in with respect to travelers and so on. Everyone really should be thanked for playing their part. And so we will be back next week, Wednesday, for another NEOC COVID-19 weekly briefing. Until then, take care, continue to maintain the protocols and the measures for your own safety and security. I am Les Roy Williams.
is on.